Why would a joint hurt worse after a cortisone shot was performed? In my latest Ask the Doctor video, I discussed what a patient might expect after a steroid injection and when it might not be that helpful. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is yet another video in my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. And the question is one that I actually got from a patient not that long ago. I didn't do the procedure, but they came to me afterwards. But the question from the viewer is simple. I have a torn labrum in my hip. I've had 2 cortisone injections. Both caused me more pain. After both cortisone shots, I could barely walk. Is that normal? First of all, before I give my thoughts, this is not medical advice. In this video or any of my videos on social media or on my website, this is just meant for information and educational purposes only. As far as pain after a cortisone shot, typically no, it's not typically all that painful because in addition to the steroid, what's also in that injection are numbing medicines, either lidocaine or marcaine or both. Now, sometimes it can be more painful than others. And in the hip, there's not that much space inside the capsule surrounding the ball and socket part of that joint. And if there's enough fluid injected, it distends the capsule and can be painful for a while. That's why MR arthrograms, the MRIs where they inject dye into the joint to make it a more accurate test that's used in some circumstances, those are significantly uncomfortable because that's a lot of fluid and it really distends the capsule of the joint. This could be what's going on in this viewer's case. Maybe they didn't use a numbing agent like a lidocaine or a marcaine. As far as what normally to expect, usually with steroid injections, you do get significant pain relief for an hour or two. That isn't the cortisone, that's the lidocaine or the marcaine, the numbing medicine to make it go away. Sometimes that'll last for a day or a little bit more, but usually it's much shorter. That's not a benefit of the steroid, the cortisone, that's a benefit of the numbing medicine. The other question, and this is a little different than what's asked here, is it's hard to imagine that the cortisone shot was going to help a labral tear that much anyway. Cortisone is purely an anti-inflammatory, decreasing pain in an area. It is not getting a labral tear to heal. It's the same reason it probably wouldn't help a meniscus tear or a number of a labral tear in the shoulder, a number of other different problems. It's not fixing the underlying problem. Plus, I have concerns about cortisone shots injected into a joint because they've been shown in numerous studies to speed up the breakdown of cartilage and bone and speed up the development of arthritis and speed up the need for a joint replacement. Also, make tendons and ligaments more likely to rupture and less likely to heal. So I'm not a big fan, even as a one-off treatment, but certainly not over and over again. I think there's a number of different regenerative treatments, yes, that are experimental, and yes, insurance doesn't pay for them, so they're not for everybody, but I think that can be much more effective. Now, if you have an orthopedic injury and you want to hear about options other than surgery and other than cortisone shots, click the link in the description under this video, fill out the contact form, and you can learn more about scheduling an appointment with me. Also, I'd love to hear about your experience, whatever the injury is, so leave those in the comments below. Just understand that if you leave a question in the comments, I can't respond with medical advice, but I might answer your question in a future Ask the Doctor video. Make sure to subscribe to my YouTube channel, click the bell to be notified when I release a new video, and when I start another live stream like my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.